Expanding tests for COVID-19, pushing the race for a vaccine, and hoping to find drugs that could effectively treat people with the virus. The president rolling out numerous lines of attack, including a self-swab idea. He wants the FDA to cut through red tape and examine whether that would work. Let's unpack it all with a couple of medical experts tonight. Chief Clinical Officer at Providence-St. Joseph Health, Dr. Amy Compton-Phillips, and former medical director of the Peace Corps, Dr. Steve Weinberg. Great to have both of you with us tonight.
Thank you. Good to be here.
So much.
Okay, so let's start with the swab idea. Dr. Steve, we'll start with you. What do you make of that? Because it sounds like the process for getting the test is not a pleasant one, but it may not be so easy to do it yourself.
No, that's going to give us a lot of false positives, Shannon. Can I use a non-medical term? My grandkids would call it icky. You have to take this little tube and a little swab and run it over the floor of your mouth to get back to what we call the nasopharynx. That's in the back, and that's where the culture has to be done. As a surgeon, I had it done to me every month for bunches of years, and after the first couple of times, I did it myself. But most people are gonna stop. It feels funny, and they're gonna culture their nose, not their nasopharynx. Going to get a lot of false negatives.
Okay. All right. So today we also heard some news that was a little bit different, and I know we're gathering new data every day. This is what Dr. Deborah Birx had to say about the age groups and this illness.
There are concerning reports coming out of France and Italy about some young people getting seriously ill and very seriously ill in the ICUs. We think part of this may be that people heeded the early data coming out of China and coming out of South Korea that the elderly or those with pre-existing medical conditions were at particular risk.
Maybe younger people, healthier people, thought that there wasn't a serious risk for them. Another CDC report that comes from the New York Times says this: 20% of the hospitalized patients and 12% of the intensive care patients were between the ages of 20 and 44, basically spanning the millennial generation. So, Dr. Amy, what news do we have? What message do you have to people of all ages with this now in mind?
Well, this is exactly why we're telling everybody to wash their hands and do social distancing. We've actually had several conversations with physicians in China as well as physicians in Italy, and they did have young patients who had serious disease. It's just that they lived through it. So they lived to get off the ventilator and recover from the ICU. And so it doesn't mean that the disease wasn't serious, but they were able to survive it.
Okay, I want to put up the latest numbers that we have from the tracking map from Johns Hopkins about this. Total confirmed cases nearing 218,000, total deaths about 8,800, and total recovered about 84,100. Dr. Weinberg, what does that say to you, those numbers?
It tells me that this disease worldwide is going up exponentially, that we haven't quite got it under control yet, and we need to do all the mitigation that we can, all the things that the task force is told to do, the social distancing, the washing hands, all the things they've told us to do are going to slow this the spread of this epidemic, this pandemic.
Okay, with that in mind, I want to play something that the Surgeon General said today about this distancing and the time period we're looking at.
15 days is likely not going to be enough to get us all the way through, but we really need to lean into it now so that we can bend the curve in the next 15 days. And at that point, we'll reassess.
Okay. I mean, Dr. Compton-Phillips, what do you think we'll know within 15 days? Where will we be in this process?
So what we're going to know is whether or not we're doing enough to flatten out the curve, because the risk of this pandemic is it doubles and doubles and doubles, and that means it makes a curve like this, and we get this huge, very fast increase in numbers of cases, which means we'd have everybody sick at the same time and completely overwhelmed hospitals and completely overwhelmed ICUs and ventilator capacity. When we started implementing social distances, if you consider it takes about a week after you get exposed to this germ to start getting symptoms, and about a week after you get the symptoms to get sick enough to get in the hospital, it takes about 2 weeks for us to see the impact of the social distancing. So we're not going to see the benefit of all this shutting down the economy and shutting down our lives for about 14, 15 days. And after that, we should see a significantly leveled off rate of infections.
So
but until then, it's going to go up.
Buckle up in the meantime. Dr. Weinberg, very quickly before we go, I want to ask you about the Wall Street Journal had an exclusive report today that the Trump administration was pushing. They wanted to move ahead with testing drugs to actually treat the virus, and that there was great pushback within the FDA. Of course, they have concerns about whether people would be harmed in the process. But, you know, he's done right to try. He's really tried to roll back red tape and expedite things here. What do you make of that report in the Wall Street Journal?
Well, the president's supposed to have some announcement tomorrow morning about the FDA. I'm looking forward to that. There are certain standards that we as physicians know we have to follow. Double-blind studies. We just can't throw a bunch of drugs out in the street and see who gets well. But I know they're testing at least 5 antivirals. We're testing some malarial drugs. And we're going to come up with something in the next month with some pretty good statistics that are going to give us a pretty good lead on what's going to work, what's going to be therapeutic for this pandemic.
Well, that is good news, but as you both point out, there's going to be this interim period where we're being asked to sacrifice, and it's going to be frightening, but hopefully we shorten that period because of what we're doing now. Dr. Compton-Phillips, Dr. Weinberg, thank you both for your time.